Hi students, welcome to the next session in oral pathology. I'm Dr. Gopi Krishnan discussing oral pathology with you. Okay, so in this video we are going to learn about first salivary gland tumor, that is a pleomorphic adenoma. I think pleomorphic adenoma is very familiar to you, very much important lesion that you may have studied in the UG preparations. Okay, pleomorphic adenoma. See, in this video, we will discuss about the competitive exam aspect of this pleomorphic adenoma. Okay, so see, pleomorphic adenoma, it's a benign salivary gland tumor. Okay, so let's start with the pleomorphic adenoma. I write a short form pleomorphic adenoma. So it is the most common benign salivary gland tumor. So the facts, Okay, all the facts we have discussed in the first video, so I'm not repeating it. It is the most common benign salivary gland tumor, and mostly it comes in the parotid. Parotid is the favorite site. Okay, and this other name for this pleomorphic adenoma is a benign mixed tumor. Now, benign mixed tumors, and it is a misnomer that you may have heard in your UG time. Your teacher may have taught you that this is a not a true mixed tumor. It is called a benign mixed tumor, but it is not a true mixed tumor. A mixed tumor means a tumor which is arising from one or more germ layers, ectoderm, endoderm, mesoderm. Okay, that is a mixed tumor. But pleomorphic adenoma arises only from your ectoderm. Okay, salivary glands, your epithelium derives from your ectoderm, right? So salivary gland develops from the ectoderm. In pleomorphic adenoma, you can see components which are supposed to be arise from other germ layers. Example, you can see chondroid areas, cartilage areas, you can see bone areas. So we feel that this is a mixed tumor, but it is not a true mixed tumor, but still we call it as a benign mixed tumor. Now, why we call it a benign mixed tumor? Because it has components from the ectoderm, means the ductal epithelial cells. It has components from the mesoderm, okay, and it has components from the endoderm, as they have cartilage, bone, etc. Okay, so this is why we call benign mixed tumor. Now, I'm not going into the basic details. The most common site is your parotid. Most common site is your parotid, and intraorally, if you see, most common site is your palate. For minor salivary glands. Okay, most common intraoral site. That is for your minor salivary glands. That is your palate. So these are all discussed in the first video. Now let's come to the salivary gland tumor. Okay, pleomorphic adenoma. Now, how to learn a salivary gland tumor? Uh, you know, we have learned cyst in the form of lumen, lining, and capsule, right? What is in the lumen, how is the lining, and what any specialty for the capsule? This was the way we used to learn cyst, right? Salivary gland tumors, there is two things you should know. What is a cell type? Okay, whether it is luminal, whether it is subluminal, or whether it is biphasic. Okay, and what about the architecture? Architecture. Okay, architecture means in which pattern the cells are arranged. Okay, what type of pattern these cells show, whether it show a ductal pattern, whether it show a tubule like pattern, whether it show a trabecular pattern, whether it show a solid pattern, okay, solid sheet or tubule or trabeculae or ductal. Okay, which type, in which architecture the cells are arranged, that is the speciality of salivary gland tumors. Okay, so in salivary gland tumors, you have to see two things: which cell it is, luminal or abdominal or mixed, and the architecture. Which architecture they are arranged? Are they arranged in a honeycomb pattern? Are they arranged in a Swiss cheese pattern? Are they arranged in a tubular pattern, trabecular pattern, cribriform pattern? Okay, party wall pattern. You have so much of patterns names. That is architecture. Okay, so you will see that in the classes. Okay, now here in pleomorphic adenoma, which are the cells? It is a biphasic tumor. Okay, so that's why I discussed about this biphasic, monophasic, etc. It's a biphasic tumor. It has both your ductal cells and your myoepithelial cells. Okay, both cells are there. Architecture is that in this, these ductal cells are arranged in a ductal architecture. Okay, these ductal cells will be forming ductal structures. Ductal cells will start to form ductal structures, and myoepithelial cell will have no architecture. It should be freely floating or freely dispersed in the stroma. Okay, so that is a pattern architecture. here. So in pleomorphic adenoma, you can see that there will be, if you take the histopathology, you can see that there will be ductal cells arranged in forming ducts like this, ducts like this, that is, they form ductal pattern. And you have myoepithelial cells. Now, myoepithelial cell, how can you identify a myoepithelial cell? What are the different shapes a myoepithelial cell can take? Myoepithelial cell can take different shapes. Okay, they can be present in different shapes. They can be either spindle in shape. Sometimes they have spindle in shape. They can be plasmacytoid. What do you mean by plasmacytoid? Okay, epithelioid, plasmacytoid, basaloid, oid means it means like, looking like, okay, or resembling like. Okay, plasma cell, plasma cell is a oval cell, or is a oval shaped cells with a nucleus towards one side. Okay, that is eccentrically placed, not in the center, eccentric, okay, outside the center. Okay, so eccentrically placed nucleus is the peculiarity of plasmacytoid cells. Okay, so this myoepithelial cell will look like that. They too will appear oval in shape with the nucleus pushed towards one side, and it will look like a plasma cell. That's why plasmacytoid. If it is looking like an epithelium, we say epithelioid. Means if it is a polygonal in shape, we call epithelioid. So the myoepithelial cells can take spindle cell, plasmacytoid, epithelioid, or it can sometimes be clear cell also. Okay, they can take any shape. Myoepithelial cells can take any shape. They can be spindle cell, plasmacytoid. Okay, any shape. That is one peculiarity. Then one another important thing, you see that in the stroma of this pleomorphic adenoma, there is a variability. We have a variable stroma. In most of the tumors, there will be a collagenous stroma. Okay, nothing much rocket science in that. Okay, most of the tumors will have a cell, a tumor, their architecture, and a very humble, simple stroma, a collagen stroma. But pleomorphic adenoma is little higher. Okay, little variable. That's why we call it a mixed tumor. Okay, they have mixed component. They have components from the other looking like other ectoderm, other germ layers, right? They have component from the other germ layers. Like they have in the stroma, they will have some cartilage. Okay, so imagine a salivary gland tumor with the stroma contains some amount of cartilage, some amount of myxoid regions, some amount of mucoid region, some amount of osseous regions. Okay, so bone, cartilage, mucinous things, and myxoid areas in a salivary gland itself, in a single tumor itself. So the stroma is variable. Stroma, we say it is variable. They have a chondroid stroma, some cartilage can be seen. Okay, myxoid stroma, mucoid stroma. Okay, rarely we can see osseous. Okay, osseous. So I should write chondroid here. Okay, usually it comes mucoid first. Mucoid stroma. Then comes myxoid, make some chondroid. Most commonly it is mucoid stroma. Then comes your myxoid stroma, chondroid, and rarely osseous. Means we can see bone, even bone inside. Okay, so this is how what stroma of myoepithelial cell look like. Now, can you see this? This is the histological picture of your pleomorphic adenoma. They may ask you in a IBQ, but I have not seen they have asked a pleomorphic adenoma's histology. But you should be thorough with it. Okay, and it is very simple. You can see this ductal areas. You see these ductal areas. These are all the ductal areas. Means they are all the ductal cells, and in between that you are seeing this dispersed spindle cells. Okay, these spindle cells, they are spindle cells, they are myoepithelial cells, and they are dispersed in it. Okay, they are dispersed in it. So there is no demarcation of this tumor cell and the stroma. In most of the tumors, there will be a demarcation between the tumor stroma and the tumor cells. But here, there is no demarcation. The tumor cells are freely floating or freely inside this stroma, and that is called melting away effect. Melting away effect. Melting away effect is nothing but the tumor cells are freely into the stroma. Okay, there is no demarcation. No demarcation. Okay, so if you see the higher power of a plasmacytoid cell, so this is a myoepithelial cell. Can you appreciate in this picture? You can see that if I am taking this cell, Okay, thus you can see that the nucleus is towards one side and cytoplasm is towards the other side. Okay, you can see in almost all the cells, if I take this cell or this cell or even this cell, you can see that the nucleus is pushed towards one side and cytoplasm is on the other side. So this is a particular picture of a plasmacytoid cell. Plasmacytoid. Okay, plasmacytoid cell with that eccentrically placed nucleus. So this is a myoepithelial cell. Okay, this is how myoepithelial cells are present, and see how it is freely floating freely in the stroma. It is not interconnected at all. Okay, so this is about your pleomorphic adenoma's histology. Okay, now let's see what else you have to learn in pleomorphic adenoma. There are so many questions. Other than this, they have asked certain tricky questions in this, and those students who are focusing on INACET, they should know the gene mutation. The gene mutation which is seen in pleomorphic adenoma. I hope you are all familiar with this gene, that is PLAG1. Okay, pleomorphic adenoma gene 1, that is PLAG1, pleomorphic adenoma gene. The name itself, it is there. But this is only for 80% of the cases. 80% of the pleomorphic adenoma has PLAG1. In INACET previous year question, I think 2 years before, they have asked one question, which is a gene mutation for pleomorphic adenoma. Which among the following is the gene which is mutated in pleomorphic adenoma, and there was no PLAG1 in that. Okay, there was no option of PLAG1 in that. The other gene they have asked, that is HMGA. Okay, HMGA is the 20% cases. The other 20% cases, you have HMGA gene mutation. Okay, so you should be when you are learning, you should learn complete. So every student they will be learning PLAG1. They will be satisfied with PLAG1, and they knew that. See how they are picking up questions. Okay, they want to puzzle you guys. They want to make you guys wrong. Okay, but we won't go wrong because our preparation is complete here. Okay, so gene mutation is your PLAG1 and HMGA2. Okay, HMGA, it's actually HMGA2, but HMGA is enough. Okay, now there are certain questions in the previous question paper they have asked. What about the recurrence of pleomorphic adenoma? They had a statement. Okay, so pleomorphic adenoma usually do not recur. Recurrence is very less, but they had a statement that if it is coming in the submandibular gland, a pleomorphic adenoma, imagine a pleomorphic adenoma came on parotid, and in another person, a pleomorphic adenoma came in the submandibular gland. They both had the same treatment. In which patient that will recur more? They have a chance of recurrence more. The patient who had a pleomorphic adenoma in the submandibular gland has a higher rate of recurrence. Okay, so pleomorphic adenoma in a submandibular gland has higher recurrence. So this is a fact. This is based on the incidents they see. Okay, so this is one factual question, which among the following statement is true. Okay, recurrence is less, but pleomorphic adenoma, which is opening on the submandibular gland, has more chance of recurrence. And you know, other than the histology, you can sometimes see crystals. The crystals are seen in pleomorphic adenoma. Some kind of crystal structures. If you see the histology, you can see some kind of crystal structures in the tissue. Okay, so what are those structures? Example is tyrosine crystals. Tyrosine crystals or tyrosine rich crystals. Okay, collagen rich crystals. And the last one is oxalate rich crystals. Okay, these are certain crystals which are seen in the salivary gland in the pleomorphic adenoma. And pleomorphic adenoma can sometimes transform to a tumor, a carcinoma. Okay, pleomorphic adenoma can convert to a carcinoma. Okay, in 6% of the cases of pleomorphic adenomas, they can transform to a carcinoma, that is called carcinoma X pleomorphic adenoma. Means it was the X of pleomorphic adenoma. Okay, carcinoma X pleomorphic adenoma means previously it was pleomorphic adenoma, now it has converted to a carcinoma. Okay, so these are certain facts regarding your salivary gland tumor pleomorphic adenoma. Okay, hope you understood pleomorphic adenoma. Okay, and you can see that the swelling here. Okay, this is how it presents. It presents as a swelling in the parotid region, right? Okay, can you see that? It's a benign, slow growing. Now you should understand the difference between a malignant and a benign tumor. Benign tumors are slow growing, it won't metastasize, right? All these things, and you're familiar with the histo here, okay, the plasmacytoid cells here, and I hope you are familiar with the mutations, you are familiar with the questions. Okay, so that's about pleomorphic adenoma. See you in the next video with the next topic. Bye.